to this meeting of the Overview and Scrutiny Committee on ready to stream. Sorry. And I'm Councillor Mary Wheel, Chair of the committee and arbitrary tonight's meeting. We're being streamed live on YouTube, and members of the public and media obviously are welcome to watch. And I welcome everyone here and online. Before we start the meeting, can I ask everyone to turn off or mute their phones? Because we are, as usual, starting with 72 seconds of silence to remember those who lost their lives in the Grenfell tragedy. We'll start with silence. Just to confirm, if everyone is to confirm the membership of the committee, which you will find on your agenda, and the fact that I am chair and Will here is vice chair. We've received apologies for absence from Councillor Greg Hammond, and we have apologies from anybody else. Have you got any declarations of interest under A3 from members? Okay, thank you very much. And minutes of the previous meeting have been circulated. Do the committee agree that I can sign them as the correct record? Thank you very much. Paper A5 is the North Kensington Recovery Programme report from the NHS. So very warm welcome to all of you here. Thank you very much indeed. I think you're going to possibly introduce the paper. Perhaps it'd be a good idea just to introduce yourselves. I can see who you are, we're just councillors, but introduce yourselves and your roles. And then I think you've been told what we're expecting. So thank you very much.
Thanks very much. I'll start with me, Rob Hurd. I am the NHS North West London Integrated Care Board Chief Executive, ultimate accountable officer for NHS in this part of London. I think, and I'll introduce the team as we go through in the interest of time. So very briefly from me, I just wanted to provide some assurance that whilst we are the successor body of the Clinical Commissioning Group West London Trust that took on the NHS responsibilities at the time that the North West London Integrated Care Board, which following the abolition of the Clinical Commissioning Groups on 1st July 2022, has made sure that we've inherited this and are continuing to pay due attention to the importance of this by continued investment in the team that we have to support that, and that this is a matter of focus in our top 7 items of risk that we manage as an overall board at NHS North West London, to keep assurance on that we have line of sight and attention being appropriately paid to the support to the community around the services we've committed to be providing in the NHS around this. That we acknowledge our responsibilities to account for the funding that was allocated to us, the 50 million that has been in place, and part of what we'll be picking up today is the transparency and the reporting of that, and any questions and assurance that you would like around what we need to do around that funding. And that I'll be handing over to Mary to take you through. So Mary is our director specifically allocated to this and has done an immense amount of work over the years. So whilst I am new to this over the last year, I have my absolute assurance as the new accountable officer for the NHS that this is very much high on our agenda, that we will do this through supporting place in North Kensington and North Kensington team and keep that support infrastructure in place going forward and are committed to the continued funding of that support over the years ahead.
I'm Mary Mollison, Director of the Income Recovery Programme, obviously said. So what I plan to do is do a canter through paper highlighting key issues as we discussed, and then I'll hand on issues to the primary care staff.
Fantastic. Can I just ask you, I'm really sorry, to speak up as much as you can. This room is terribly awkward. We're oriented this way because of the cameras, but our actual audience is over there. So no, I'm not expecting you to look two ways at once, but if you could just try and project your voice a bit, I'm sure the audience here will very much appreciate it.
No problem at all. So we're all here because of the terrible tragedy that happened back in June 2017. However, just to point out that from our perspective, on the 19th of September 2018, Dr. Fiona Wilcox, coroner at the time, instructed us quite clearly through a Regulation 28 Prevention of Future Deaths notice that we should put things in place that would actually identify any problems in order to prevent any future deaths in the population. So that had 8 recommendations, and we are very clearly still working for those. And that's not only for survivors and bereaved, but also for first responders and site workers. So I wanted to make that point at the beginning. So we then submitted a business case to NHS England in December 2018, which was approved in January 2019 for additional services. Up to that point, there had been additional services funded at additional cost over and above the budget for West London CCG in order to be able to deal with the initial aftermath fire. But that business case released for us the 50 million, and we'll make it clear that 50 million does not sit with the ICB. It actually sat with national NHSE, and each year we are required to give clarity as to how the money has been spent, what it's been spent on, and also the activity that's gone with it, and to face challenge around any particular concerns. As part of releasing the funding from April 2019, we also undertook a health and wellbeing strategy review for Grenfell to understand from the community what they wanted in order to be able to better address that and to have some clear outcomes from them. What do they want services alongside the current requirements? So that health and wellbeing strategy we ended up publishing in September 2020. COVID hit in between, which delayed our publication, ready to go in March, but it just the timing was not right. Although that was quite a comprehensive document, we have actually since then, post-COVID, actually done a review, and that document is contained in here as well at the Health and Wellbeing Services. So we're quite clear from our communities, and we've worked with various groups across the community to understand what they saw as their needs. It's divided into clear 7 kind of work streams. I move on. There's a range of services, and I'm not going to go through them all. They're here that we provided, but I would want to highlight our adult respiratory services. They were particularly impacted, as you can imagine, by COVID, because it was the same group of clinicians who were providing these additional services who were called to work in the COVID pandemic. So there were some alternatives tried around how to maintain contact with communities and survivors in particular. I wouldn't say that all of them were successful. Some of them were virtual, and some that hadn't worked. But the service still continues. We now have a new consultant leading that service as of this year. If I move on, unless there's any particular questions on that, one of the things that we have perhaps been slower off the market doing, but we are very much a resource to look at, is health outcomes. And that's a challenge for the NHS as a whole. But for this particular programme, when things were put into place, we're now almost looking back to say, well, actually, from what the objective was, what was asked of us, how are we measuring that? How are we actually giving evidence that that has made the difference that it's expected to? And we're not finding it easy. So in some areas, we've got lots of very clear health outcomes. Others, it's less clear because some of the work is very individual, and what works for one person and produces a positive outcome may not work for another. Having said that, it's not that we're giving up on it. We currently have 23 clear outcomes that we're measuring, but we are working with some of our services to make that even clearer. And what you have in the pack is a Q3 report of where we've got to in terms of that reporting. And some of that will actually contribute towards the Grenfell or North Kensington Joint Strategic Needs Assessment that we're working on to make sure that we're clear on how we measure what we do. And a lot of what we measure, yes, it's health and there's clinical things we can measure directly, but there are wider things which are around housing, economics, that actually are a combination of how we work with our partners to live that, so our partners in the rural borough as well. So if I move on then to finances, and I'll give a little bit more time. With the business case that went in initially, it gave an outline of services because none of us at that stage knew exactly what was required. We were very clear from disaster recovery that mental health was going to be a big focus, and that has remained still as a big part of the NHS service. But over time, it became evident the advice from external partners, including the then cash balance, was that we actually needed to think about longer term monitoring and how we could do that. So we set up at the time a range of services to meet that. However, we have every year looked at those services, looked at the activity, taken feedback from our communities, and then actually tried to modify and to develop those. So I'll give an example. It's one of the areas where perhaps the NHS is perhaps more challenged. Some of our non-medical services, so whether it's befriending, whether it is massage, yoga, that we put into place, having listened to some of our communities saying we don't want a medical model of health. And some of our GPs have actually confirmed that for some patients that just would not have been the right thing. But by accessing some of these other alternative services, either they've not needed to go on to use NHS services as we know them, or else they've almost been a stepping stone where some people use them and felt, okay, I feel ready now to access some of the therapeutic interventions that are on offer. So for us, having done this work initially, we then put more money into some of our non-medical services, our social prescribing. Within that, we've given a breakdown of what happens, but in Appendix 7, we've actually given a spreadsheet which goes through our spend to date.
And can I just welcome that, because I think this has been the first time this has been in the public arena. I know that some of my colleagues have seen something like this before, but I really welcome the openness, and I hope that this is going to continue and that we will see more of this. So just to say how much you're welcome.
So I'm not going to go through line by line. I thought just to give an overview. As you will see,
Page 169, everybody.
Apologies. I'll move on. If you look at the expenditure, so our mental health services, our Grenfell Health and Wellbeing Service, comprises 56% of the spend. It's what we would expect in terms of the investment that was required over time, and but it's not the only area. I think our disaster recovery literature tells us that whilst that may be the initial and will continue to be ongoing, as we get further post the date of the disaster tragedy, that quite often other physical symptoms begin to appear. And I think it would be fair to say that that's what our GPs are telling us they're seeing more of. People presenting, in fact, I think presented before with physical conditions that then either need treatment or further management or referral. So if I move on then to what we called our dedicated service line. So those are services specifically for survivors and bereaved. So I know in the council we have a dedicated service that deals with that. So we created something similar for health. It's run by CNWL and actually does a lot of case finding, pointing, signposting and linking to other services. It does a small amount of therapeutic intervention as well. Alongside for the dedicated service, we have a long-term monitoring service that I've mentioned for respiratory, because that was a key concern from the beginning. And then we have a paediatric long-term monitoring service, because the health of our children is important to us going forward. So that service, those services we would expect to continue over many, many years to come. Alongside that, we have some physical case management, which are for those who are within a community who they may be coping one day, but the next day they actually need some help and support, maybe accessing health services, maybe accessing other things that are out there. And then we actually have survivor and bereaved enhanced health checks. We know the term is contentious, but we couldn't think of another name for it, but it's additional testing over and above the core services that the NHS funds that we put into place to be able to understand their health needs and the things that are worrying, be it from sleep disorders, right the way through to, detecting that somebody does need to be referred on into more primary care, but more complex services to meet their need. We also within that have a certain amount allocated for toxicity, which is a specialist service run by St Thomas's, where we have two specialists in the country who have made themselves available. Only small numbers of people have taken up from the survivor community. If I move on, a large part of our services around primary care. They were there at the beginning, they were on the ground, they're still there. It has been challenged throughout the period of time with activity, with access. So we actually funded additional resource for GPs to be able to access, to allow extra time for people impacted by Grenfell, survivors of bereaved and the wider community to be able to see GPs. That has been a challenge to us. I won't easy, and I'll hand over to Andrew in a minute so that he can actually talk through a bit more of sort of the issues facing primary care. But I work through the rest of the funding. So the self-care and social prescribing, as you see, has a separate line in it, where we have actually worked with our voluntary sector communities to be able to deliver a range of services with some of the smaller community providers of services. In addition to that, at the moment, we're looking at something that we're calling an investing in health to address inequalities as a result of Grenfell. We're working that through, and that would be looking at our communities respond to what they've asked for, a community-led recovery, where they can actually take on health aspects and actually deliver against them for us and with us. So if I move on, one of the key bits for us is actually around engagement and consultation, actually hearing what is being said. Now, as much as we try, there are various groups in the community. We do our best, and we know that sometimes we don't get to them all. So we've tried to have the spread. We're certainly working with public health around making sure that as we go through the Joint Strategic Needs Assessment review, we're partners in that, and we will do as much as we can together. And then we've clearly got a section on children and young people. I think we know that there's more that we could do. Children who were 5 at the time are now 11. Therefore, what are you doing to actually enable them? And we are getting messages. Some children don't want to be labelled Grenfell children, so we do have to be careful how we manage that. We're working with schools a lot of the time to make sure we deliver those services. We're looking at social prescribing for children, different to adults, but actually meeting their needs where they're at, whatever that is, and that's taken different forms up until now. We're normally working in partnership. We're looking at sort of peer group support so that young people can talk to each other about health issues. Then if I move on, we have an ICB staffing line here, and this is a programme. It has required I can't say a small team because everything's shrunk in the CCG, so it's probably one of the in the ICB. It's one of the larger teams in the ICB. But actually looking at how we meet the needs across acute mental health, our physical health needs, but also our social prescribing and our engagement and our comms. You will see a line in here. I won't touch on the programme evaluation operating because there are some costs for example, software packages, etc., that we incur. But the programme future services development total, that's where we have certainly kept information, or where there's been underspend from year to year. We've kept that with a view that if things came up, we would then be able to use that money moving forward. And I will say that with Rob sitting to my right here, one of the exceptions here is that we have been able to carry this money forward from year to year. That is unusual in the NHS as well, So being able to do that so that if we hadn't spent it, we've been able to move it forward. You will see that in 2020 to 2021, there was a larger amount carried forward. And that was because we were expecting prior to COVID to have a lot more spend on community activities. Of course, we couldn't do that, but we carried that forward. So that's why the explanation at the bottom as to how we're using that funding. And then I will finish off by saying you will see that going forward, we have a forecast expenditure for 2024 to 25 of about 4.4 million. And that again is saying if we don't spend what's predicted, we would have that anyway. We may have more if we don't spend on this year's. So I think probably that's as much as I'll say for now. I'm sure there'll be
You've
questions.
given us a very good canter through.
Yeah, so, so my name's Andrew Stephen. I'm a GP in the borough, but I was previously CCG chair when we had the West London CCG, so that takes us pre-SDB, and I'm now borough medical director. So I have a bit of understanding of the history of this. So just to give you a canter through, because I think Mary's done a really good job in the overall services.
Yes, and I know my committee are dying to ask questions.
Primary care, yeah. So primary care was there from day one in the initial response, but we set out. So we very soon realised that we needed to bring in extra services. So extended access and extended appointments was commissioned from primary care to support them, giving extra time to patients, as well as enhanced health checks, which is something that primary care has been doing as well. We're very aware that, as in any other part of any community, there's a variability in service from different practices. So we've encouraged the practices to work together to address variability and to support those practices that find it more difficult than others. So we have got 2 PCNs who are very particularly in the borough, so primary care networks who support each other. So that's Neo Health and Inclusive. Although all the PCNs are working together through the federation to try and support the North Kensington. So we've also put a lot of extended access services into the North Kensington area. So we've got services that we're centering in St Charles, which are supporting primary care as well as extra training that we've given to the practices. And most recently, we've launched the cultural competency training, which is something we're rolling out through practices too, which is about understanding how you give messages and how messages are heard by communities as well. And that's some learning that we got both from the North Kensington response, but also by learning through COVID as well. So that's been really helpful. So I've got more to say, but I'll probably maybe use it to answer questions.
That sounds a very excellent arrangement. So I'm going to start with Claire, who is one of the ward councillors, if you want to kick off our questions. And just to say also, by the way, that the fact, although huge, was really helpful to have everything in one place. I certainly found that very helpful to read through it all. Claire.
And I would like to echo what Mary said about how useful it is to have all this. A lot of it is new to me. And I hope that you'll have this level of transparency. I wanted to ask on page 16, where you're talking about the discrete groupings of the population, because I think this underpins a lot of the work that's following.
Sorry, the page.
So you don't have the pages.
I don't know, I think perhaps there.
It's the second page of things.
Thank you very much. So actually, I ought to declare an interest. Sorry, before I go any further, because I do work in the NHS, but not anywhere near this bit of the NHS.
You're forgetting that line number. Comes to show us just.
Sorry, right, Claire.
Yeah, so my point is item 4 and the 1.2 overview of the North Kensington Recovery Programme, and where it says, yeah, page 16, population has the following discrete groupings: survivors, bereaved, residents of dreadful war, and then what I'm just going to say is everybody else. And I just wonder how much you've gone into that category of wider dreadful community, because that does include category B people, includes residents of Lancaster State, other ways. It includes the immediate community, who your own disaster literature suggests that within a 500-metre radius is the most daily impact and most likelihood of trauma. And I'm just not really seeing that why the North Kensington community really captures or has the capacity to capture the variation and the specificities of the needs within that particular or those particular groups. So when we're talking about engagement in the ask our communities, we exactly have we asked. Because I think historically over the last 6 years there's been a bit of contention that it hasn't been resident based. Not truly, not for those categories. And I just wondered, is that something that you're going to be looking at, meeting people where they are in their need, as you say, depending on which part of that wider community? Because wider community has been used from all partners in the rental response as a layer of exclusion and has caused its own former. So I just wanted to also caution against that use of wider when we're talking about the walkways.
Would you like to respond to that?
So, Councillor Simmons, yes, we do. We use that term wider. I think that was something about consistency across all our partners. However, we do work with different communities within what was termed wider. So we do work with different estates, not only the residents associations, but some of the individual groups within that, that we get a view as to very easy to cut in one way, but actually we work with different religious groups, we work with the different communities who are working within a community, so that we try and actually see the whole breadth rather than it being, well, wider community is just everyone else. So whether that's near the tower, further out, we actually work across all of those. And we do have a list of those. In a quick scan, because it's one of the things I thought we tried to submit, was a list of those groups with whom we had engaged. So that, being fair and transparent and open. But we have shared that with RBKC around the Joint Strategic Needs Assessment. So very curious to who you engage with, particularly around the reviewers of helping on green strategy.
I just really wanted to see that your own, by which I mean CWL and Redbull outreach team, for instance, who identified that 500-metre radius back in 2017, which underpinned their door knocking. If we're deviating from that, I'd like to know the reason why. And if we're not using that to underpin where we're targeting our support, I'd also like to know why. Because yes, there are groups, yes, there are residents associations, but there are also addresses where we know where everybody lives because it's in a specific radius. So I'm not really seeing, I haven't really seen in the last 6 years too much visibility, I'm going to say, in terms of engagement. There was the Healthier Communities survey and conversations, but I haven't seen anything past that. So I would like to thank you for all of this transparency here and information, which is really, really useful. I won't take
And leave the observation that perhaps there isn't enough visibility. Thank you, Claire, for being, and we all need to be succinct tonight because we've got a huge agenda, and so questions, not statements, would be helpful. But Claire, thank you very much for that, particularly as a ward councillor. Portia, is there anything you want to ask?
Yes, I do. Thank you, Mary, for this lovely section. I would just like to know, based on all these findings, I would like to know what evidence have you got to show that there's been an improvement in the program the last 5 years?
Once that's part of why we're actually looking at health outcomes, because that's our challenge, that we can do lots of things, we can count lots of numbers, and we can show activity, but activity isn't being an end. We want to see whether that's actually making a difference. And we're on that, I have to say, we're on that journey. We're not able to say to you because we've done X, because a lot of the things that are happening, health is not in isolation. You have to look at socio-economic factors, you have to look at other things that are happening in and around. And certainly our work, the work that the RBKC are doing as well, all of that contributes. So I think one of the things that is, we've got our health outcomes, but we are bringing those together over the next 6 months or so to look at what is the impact of all that has been done. And it isn't, I'm going to put this, journey is different for every individual. So for some, in terms of what we're calling improvement, it may be different for somebody. Somebody may go, that isn't an improvement, that's just getting me back to where I was prior to the fire. So we're trying to do trends to understand any trends and themes, but we're also then trying to, some of the case studies that we're having are very moving for where people feel they were and where they are now. But doing it in a large scale over the whole population is challenging. I won't try and hide it. It has been hard work for us to actually try and get that consistently.
And maybe that's something we can revisit at a future date.
Chair, I would like to also say the fact that I live in a community, I have seen quite a number of local residents' life deteriorating drastically in the last 5-6 years, drastically. And I was just wondering, could you just run me through the process of the health check-ins? How, what is the duty of the health checker? What do they do?
Survivors.
What do they do? I just want to know, what do they do? Do I go to a place? What do they do?
Yeah, so that people can access these services through various ways. So you're absolutely right. There are dedicated services for certain groups in the community, but there's always a universal for everybody. So we've got extended health checks that you can get through your GP or through a community service. So we have set those up so people can access those if they need them. You can bypass those services you want and go straight to your GP service. What we've tried to create in North Kensington is there isn't a wrong door policy. So wherever you go when you need a service, you'll be signposted to the right service. So I know we've set up very particular services for local groups, and that seemed very appropriate because those people seemed at particular risk. But most of the service that we offer are for the whole community, and it's very. And one of the other things that we're learning as an ICB is the importance of addressing inequality. So there were lots of obvious inequalities in North Kensington that predate Grenfell, but are still there as well. So it's a priority for the ICB and for us in West London and the Byward to make sure that we redesign services and reallocate resources to address inequalities as well. I'm not sure that answers your entire question, but hopefully it reassures you about the motive.
Fine. Thank you for your answer.
One. Lucy.
I was going to ask a question on, you reference it on page 27 on understanding the community and the issues that were flagged with regards to the cultural awareness, the cause of some not accessing primary care. And I know on page 70 you stated providing the engagement that the progress of the pilots by the Royal College and League on cultural competence was seen as positive, ensuring that continuing to be rolled out, and it clearly the fact that the community were co-producers, maybe applying that in other areas if that was such a success to what's going on there, and if are we applying it in other areas?
So that was developed, as you say, with co-production with the community. It's just begun to roll out full scale. So I had my training 2 or 3 weeks ago. We were encouraging all practices in North Kensington to have it, but for it not to just be a clinical training session, but to be for deliverers of care generally. And we will be setting expectations wider than just those practices around Grenfell, but also North Kensington generally, West London and by borough too. And we're hoping that the expertise that the co-production process brought us with cultural competency will be something we can spread across North West London as well.
I kind of wrote 2 questions into one. How will the NHS work with RDKC on carrying out the GSNA, implementing outcomes and presenting them in an integrated and easy access way to residents, and then measure the outcomes and a report back and must give us some sense of the timescale, and obviously with that penetrating outcomes. The other part of the question is, will the focus of that work be solely on, it may sound strange to put it, on current need, or will it be balanced also with enabling building of personal, community, mental, physical and well-being resilience? They're referencing King's Fund's flag, 85% of health long-term come from activities of individuals, local community. Acute and other services in NHS, at least 15%. What is the you break the next step? How do you balance resilience?
Set the context. So it's kind of why we're here in an integrated care board, to encourage the balance between ensuring we've got a focus on population and not just individual services, and within that focus on population to actually address fundamental inequalities. You know, the setup of integrated care system puts addressing of inequalities as one of our 4 purposes for our existence: health outcomes, inequalities, value for money, and wider determinants of health. To your second point, that and we see fundamentally the borough-based partnership, the place partnerships, where this team will sit in terms of North Kensington recovery as the place to do it, not the next tier up or the next tier up above that, but but to support with the resources into the place-based partnership and the team to do that and work with within the borough on the joint needs assessment. Ultimately, the population health databases that we are now bringing together. We have a whole system integrated care database, which brings primary care data. From the general practice, where we have brought together that with the hospital data, we would be wanting to work with communities on how that evidence can be brought together to inform inequalities, inform the improvement of services over time. But the strategic answer to the question is to support the continued development of both the place-based partnership here and have a team within that funded from the NHS to coordinate that partnership, and we create conditions in which the NHS is able to do that more effectively. But I hand over to Mary to talk about more detail on the specifics.
If I look at the current, you're asking how we work. We are actually doing some joint engagement. So in terms of the work that's happening around the JSNA, we're looking at wherever possible, can we do that together and we collate those results together, so that the document, the JSNA, is truly joint, collecting all of that information where possible. But we do know there are some groups in the community who aren't happy with that, and we're happy to work with them using some of the questions that are being used for the JSNA with them specifically. And we've had that direct feedback, but some groups are to do that joint, so we would lead on that. But in terms of we're looking at current needs, we're looking at what exists now, but we're also looking at how we work in wider teams. And I'll hand over to Andrew for.
Yeah, so the NHS, you may be aware of this, but the NHS is changing its community offer to some extent. So the development of integrated neighbourhood teams is a development of primary care networks where we're bringing all care providers outside of the acute trust to work together. So we in a sense, we've kind of had that by default in North Kensington since the disaster, with community mental health, community services and primary care and voluntary sector together. So we anticipate that we'll develop an integrated neighbourhood team that will develop the North Kensington recovery work as a part of our general development of integrated neighbourhood teams. That will include the local authority too. So we've set up an alignment group with the local authority to make sure that the next 5 years of our recovery business planning is something that we share. And the hope is that we can share the aims and the delivery of that together, and hopefully the recording and reporting process back to you as well.
Is the sharing of data an issue?
So it is still an issue. It's becoming less of one, but and certainly there's some anonymized data that we share. But historically it's been a difficult issue.
This one was Tom.
Just a very quick one. You mentioned about engaging experts in toxicity. Could you just explain a bit more about that and what the outcomes have been?
So because there was certainly concern from the community around what they may have inhaled, what was in the atmosphere. So we worked with Guys and St Thomas's, which is our South East England specialist for toxicity, in order to say, would they be prepared to have sessions, clinics, especially for Grenfell impacted survivors in particular, because that was the focus. Those services, they saw probably about 4. It's still open, people can still be referred in. Their clear steer was that from that, people wanting, I think, blood tests, but they were saying the stage at which they were being seen, it was more around advising as to what they may have been exposed to, and therefore might need to be put into place the monitoring, etc., rather than any specific tests. And I know that caused disappointment in many people because they were expecting to go and have, I've been and I've had this range of tests and it tells me that I'm okay or I'm not okay. But they were specialists in their field and they were very clear there weren't any specific blood tests for those who'd presented that they could do at that point in time.
Got 3 quick questions from the chair. Thank you for the presentation. To return to the first one, which was regulation 28 from the coroner, page 34. The coroner mentioned 8 outcomes that they were primarily concerned with for section 5. And my first question is, as a result of meeting people in the community, were there additional things to the coroner's 8 that came out of your meetings with residents that need to be focused on within your programs? Because of course this was done almost independently of meeting all residents. So that's my first question. My second question is in relation to page 135, 3.42. I'll let you turn to that. And this is in relation to the self-care programs. I noted that the demographic is provided in the chart at the bottom of the page. And I was going to ask whether, bearing in mind that over 50% of the community were Black, African, or Arab, whether any of your programs were targeting specifically the majority groups that came to you and came forward in that particular regard. And my final question is about money. So if you'll turn to page 169. This chart is just a good overview, but I'd like to see a little bit more detail if I may. So if you've got the actual themes that go into this report, that would be very useful to see. But the two questions I've got on this particular page, you mentioned dedicated service, I think, Mary, when you spoke. I'm looking now at the first blue column, forecast expenditure for the dedicated service, the second line down, and just wonder why it's 179% higher in your forecast than this year, given that the trend appears to be downwards. And then my second question on this is the ICB staffing that you mentioned, to get some clarity and transparency on the staff that are actually working on this as a dedicated program, work out whether they're actually separate people you have to bring in to do this program, or they're NHS people that were there already for the last 25 years and have just got them cross-housed. So just to understand all of those questions. Thank you, Chair.
Still right out. I'll start with regulation 28.
Yeah.
So in our discussions with the community, I'll be honest to say, many members of the community are concerned, and having had the firefighters NERA report earlier this year, concerned about potential risk to their health, which could be cancers, etc. So that has clearly come through. We are actually seeking expert advice from the Chief Scientific Advisor's Office, because what we have currently was the advice of the previous advisor from the office. So therefore, if we were to offer anything else, we need a steer as to what it is we could or should be offering in addition. So for us, those are kind of the key things that I would say has come out additional to the regulation 28 requirement. You know, what are blood tests? But we have to know what we're testing for. You know, how you're going to store it, if you're going to store things, you know, how you can access it, so that it's a lot wider than the NHS providing the service. It is about what that does and how we manage that over time, and how we actually don't give people a false hope. We do something now and say you're fine, and then 5 years' time something emerges. So we are seeking further advice around any additions that
Second point was on the groups, and the majority groups.
So we do have the demographic breakdown of the area, and what we have done, whereas the self-care programme is available to all who will take it up, we actually are reaching out, and we have a group called the Health Partners, who are community groups. Some are religious or faith groups, some are actually other groups in the community who work, that we have worked with to try and reach into some of the communities where they haven't appeared, they haven't come forward. So how can we, one, understand what their needs are, but two, take the services to them. So an example of that for us was a women's group where they were actually worried about, actually during COVID, they were worried about their physical health. English wasn't their first language, so we actually managed to get translators in and run a remote virtual call around a specific issue that they had concerns over. So we're trying to reach into the groups and work with them around the things that are their concerns. I think that's the other thing I probably would want to highlight, that we have been very good in the NHS at thinking, this is a group's concern, and we'll take this to them. It is about hearing what the concerns are of those communities and addressing those before we go along with perhaps all the rest of the health messages that we have. You know, get your cervical screening, what is it that they're worried about? Because unless we address that, we're onto a loss because we can't do that. So we are trying to look at what the demographics are and how we reach into the community to get them, which might not be through our usual NHS routes, but might be through partners who work with us.
On the money, just, I mean, we can provide further breakdowns. I think it's probably important to acknowledge the way we spend money in the NHS is in different forms. So there are service contracts and we pay primary care for services. There are employment contracts where we employ staff, and yes, to take on the direct point around the ICB staffing dedicated to this, these are dedicated team to this and being ring-fenced for that purpose. And there are other sort of direct contractual payments, and there are service payments, and there are direct staff payments all included in this. And therefore, where there are service payments, the issue is probably around the performance and whether we're getting what we're paying for in that service, as opposed to whether how that money has ended up being spent at the final point. If that makes sense. Yeah. And there's a range of those things on this, and that's the way we operate.
I've got a couple of questions, but I'm really only expecting brief answers because it is getting late, and I thoroughly do appreciate all your input. I suppose we've heard some feelings of frustration from the community about some of the services that they can't access or whatever. And there has been talk about an individual health budget for some people, just as we have an individual budget within our dedicated service. Is that something that you are actively considering? Also, again, this is really useful. It doesn't tell us anything about your spend on community groups to deliver some of this, and I think that would be where you're commissioning from community-led groups. It's not giving us an indication of what percentage of the spend. Have I missed something, Mary? You're looking. Well, you can point out to me afterwards if I'm wrong, but I think that's of interest to us because it's an indication of working with the community. So individual health budgets, a little bit of detail in that. And just, I welcome your commitment to reporting at this level of granularity and detail, and perhaps even a bit more in future, because I think it gives reassurance and an ability for us to really look at what the NHS is performing in the same way that we like to try and think we're transparent to. So working together is a very good foundation. But just those 2 points.
Yeah, on individual health budgets, I mean, as a generic concept, it's something we are considering. I'm not aware of us specifically looking at interrogating that, and I'm very happy to take that away as a response.
So we have previously personal health budgets is the term that would be used from a health perspective, and it is something that they are very specific requirements and criteria that need to be met for the use of personal health budgets. We have looked at it previously, and then we've looked at it again. With regards to the guidance and regulations that are around it. And at the moment, it wouldn't be something that we would be able to do. However, with all of these things, we do keep it as a watching brief. And if anything changes or if there are things that we can do to accommodate that, we would do that. But we have looked into it actively.
I think the message that we have is that we'd really encourage you to look at that again, and anything we can do to work together to make that happen would be good.
No, I just wanted to say that one of the limitations that I spoke to the national lead for it is that you cannot buy private healthcare, and then you can't queue jump the NHS list. So the limit, it gets narrower and narrower. So it's not something we have discounted. We just would like to understand how it could work best.
Well, I think those are 2 helpful bits of information. Certainly things I can see that there are problems, but I think it'd be really helpful if we can try and perhaps work through them together and see if there is some form that could be made to work. I think and we talked about a little bit more detail about what you're spending money on. But can I now open? Thank you very much for that. Can I open it to other councillors who are present who'd like to ask a question? Sarah, and then Mona.
Firstly, I'd like to congratulate the NHS on their first 75 years. Thank you for everything you do. And thank you for this report. I think it's the first time we've seen everything together. The only thing I would say, I think it highlighted the fact that there's not been enough joined up working with the local authority in some areas. I think some of the committee have raised the issue about funding in the voluntary sector and other areas in the community. Because we're funding some, you may be funding them. We all need to work together. We've had some really good programs in place, reaching out to different groups that are very hard to reach. So, and I think the highlight of this was the health partners. we were not part of the health partner, even if the local authority would have been. So I think going forward, something around that. I really welcome the fact it's now sitting in the ICB, because that highlights the fact we need to work together and integrated. So yeah, I think, and just one thing on data, there is an issue around data. I like the fact that JSNA slightly delayed. Anything you can do to help us get the data so we can get moving on the JSNA.
Not a trenchant question, Sarah, but I'll let it go. Then
Thank you. So Sarah's last point was one of my points about the question of data and the evaluation of the interventions that have been provided thus far. It's very difficult. I mean, it's great to have all the information in one place, but it does feel as though that's one area that's lacking. Because there's been an awful lot that's been developed and delivered, and it's odd to see that there hasn't been sufficient outcome measures. And I appreciate what you're saying about improvements are different to different people, but there must be some validated measures that we can be using. Secondly, just a really quick one about something in the report mentioning the provision of GP services, just the quality and resources being very variable across North Kensington. It would just be helpful to hear a bit more about that and where that's kind of impacting the services that parental affected communities are able to access. And then finally, there was on page 25, it's point 3.3.4 about learning from disaster recovery in literature. It mentions that you've sought advice from the Department of Health and Social Care Chief Scientific Advisor on effectiveness and extensiveness. That's specifically about the toxin measurements, or is it all of the interventions? Okay, and do we have any? Is this the first time that exercise is being done? And if not, what's been sort of thought so far?
Thank you. You want to respond to that?
Wow. Let me start with the last part of it. So no, right at the beginning of the programme, there was advice sought from the people who were then processed. Balance was one of them, as well as Public Health England at the time. So it isn't the first time. As we've moved through the programme, we've sought advice at different stages, but because we are now facing thoughts of what do we need for the future, we're actually asking these Chief Scientific Advisor to give us advice on what we're doing currently. Do we need to change anything? Do we need to add anything? And if so, what? And also to meet some of the requests around blood testing, to be clear what we need to do and what we can and what we can't do. So it actually is a pivotal point for us as we move forward the next 4 or 5 years to understand what we need to be putting into play.
Thank you. Liz, Leader of Council, just to put you on your mettle there.
There's a couple of other points on primary care and health.
Oh, right, sorry.
So I'll be very brief, but we're very aware that North Kensington is very similar to other bits of London. There's a variability in the offer in the community. So what we try to do is make sure that GPs work together so they can level out that variability. So we've got the PCNs working together to hopefully make sure there's an equal offer for access, an equal offer to services, an equal offer to things like diagnosis and treatments. And we look at outcomes and pick up of services and compare practices with each other, and then have an exercise about working out why things might be different and how we can support practices. We know that Fordham practice in particular, because of its proximity to the tower, was very affected by the number of people affected. And so we put in extra resources to Fordham practice, see if we could help them, and we brought in some extra GPs to do that. We're working with the Federation to see, which is all the practices in West London working together, see how they can support and help that variability too. And hopefully, as a part of the INT that will develop in North Kensington, there'll be work around identifying GP variability and helping to answer that too. So it's an ongoing piece of work.
Elizabeth.
Yes, and I'm sorry if someone's asked a question before I didn't get back in late, which I apologise. When you're thinking of the next stage of your services, the next 5 years, and thinking in terms of what's best for people's recovery, we certainly in the dedicated service found that, you know, people to take control over their future is very important. And we're doing a lot of work with individual budgets, personalised budgets. Is that something that you're considering? So someone could say that we lost that.
We have just,
Sorry.
and I think the NHS said that there are difficulties with it, but you're prepared to go away and have another look at it and perhaps in conference with us. No,
I just think it's something which we're finding very useful.
And so maybe our experience and could help to inform when we discuss it with you again. So any other members of the audience who've got any questions? If not, I'm going to draw our discussions to a close, which I think have been, thank you for coming in such fulsome, with such a bank of knowledge. I think we just to quickly sum up, I think it's that continued openness between us, and that those sort of level of figures and reporting, perhaps amplified, perhaps adding what is a bit more about other organisations spending on could be a feature in the future. We've had a recommendation from the local councillors about the use of terminology and a concern about visibility and openness. And we've had a discussion about personal health budgets, you know, all of which are just things that I hope will form an ongoing dialogue with us. Don't require sort of any further action immediately now, but there'll be something you'll consider. And just to thank you again for coming and reporting so amply.
Thank you.
Let's move on now very swiftly to the council plan action plan, hardly snappily named, but I'm going to have to blame for that. I am going to invite.
It's like,
So we've got
you've got such a like.
That's why I'm being a bit ruthless. I'm verging on the ruthless.
Very.
There are two very allied reports. We've got council plan action plan, CPAP, as Tom has dubbed it, and when we've got football reports. Let's start with the council plan action plan. Very brief introduction.
Okay, I'll give you a very brief one. You'll remember that we launched our council plan in March, and you remember that was informed by more than 1,000 conversations with our residents, including the bereaved and survivors. And I'm very proud of that plan, because I think it really sets out very clearly our ambitions and our intention to become the best council with the Grenfell legacy at its absolute heart. And now you've got the action plan, which sets out in detail what we're going to do to deliver the commitments in the council plan. And really, it's a tool for us as the community to really use to monitor our progress, so that you can hold us to account for what we said that we will do. We'll be publishing this plan or bring updates, performance updates to your committee as and when, because we want to show communities not only what we'll be doing, but again, that, you know, I think accountability is terribly important. So any comments, most welcome ahead of our leadership committee, which we've got, I think, on the 12th of July next week. So, and I appreciate this.
To it even now.
I think you've got so much to say. We're very happy to take comments afterwards as well as tonight.
Thank you.
If it goes into too many hours.
I'm going to start at this side of the table now. Sydney, have you got any questions that you'd like to pose to councillors?
Just one very quick question, page 119. Second bullet point up from the bottom on wardens and safety. 199. 199. 199. It's also repeated on page 218 and 2.4. Community safety is a very, very high concern, certainly for our residents in Redcliffe. And I'd like to hear a little bit more about the wardens for every ward and what you're doing with the police to make sure that they can provide either more police officers on the ground or get more people to respond to these crimes that they can suffering.
I don't have the absolute details. Gosh, that's lucky.
Stuart, come and join us.
Thank you. So, the wardens, as you'll be aware, we established the warden service. So, Stuart Priestley, the Chief Community Safety Officer of the Council. We established the warden service initially with 14 wardens, and we have expanded that very recently to the 18 wardens, which then gives us the opportunity to have a named warden per ward, and for those wardens to be able to develop local links, build intelligence, develop kind of links with the community. So we've got a much closer relationship with our residents, businesses, and key stakeholders at a local level, and our wardens. So having very recently got up to the point of 18, we will now be in the process of rolling out that warden per ward model and what that means on a local level. We will see what that will be over the coming months and into the year. And you're forgiven, what's the other question?
Liaison with the police to make there's more community safety police officers who can actually have powers of arrest, actually arrest people if the wardens can't arrest anyone.
Yes, so it's a really good question. So we have been, myself and Councillor Will have been lobbying the police to ensure that our local dedicated ward officers are not abstracted to other duties elsewhere within the BCD, mainly within Westminster. Make sure that the existing model, which is 2 PCs and 1 dedicated ward officer per ward, is maintained. We've seen improvements in the abstractions. That then gives us the ability to develop much closer working relationships between our wardens and the local police. Police are committed as part of the Met turnaround plan to increase the number of police officers at a local level. We haven't seen the detail of that yet, and we're continuing to hold the police to account for the delivery of that. Our warden per ward model gives us the ability to firm up and develop closer relationships. We also have a weekly tasking meeting and a monthly problem solving meeting, which allows different parts of the council's enforcement services, nuisance, waste and streets enforcement, not just the wardens, but also based directly with the police. So we are coordinated with the police in what we do locally, not just by the wardens, but by the other parts.
Tom, you got a question?
Yes, also it sort of follows on from that previous question on safety. So, I mean, the 2 of the big things on safety are CCTV and wardens. Sorry, Stuart, you might want to say. The trouble with such a wide-ranging report, you must need every council. So CCTV and wardens, and then in the performance reports, our next paper on safety, we've got some number of crimes in the borough. Obviously, there is a link, but it's hard to use that metric to say this is working or this isn't working. So I'm wondering, how do we judge? Is it too early? Can we judge already? And how do we judge how successful CCTV rollout and warden rollout is on making the borough safer?
Good. I was just going to start that we're putting the CCTV cameras in wards which have the highest crime rate. That's going to, I guess, whether we see the effect for the wardens and CCTV cameras when we put them in over the next couple of years. That's one of the things that you'll be asking questions for, but you're right at the beginning at the moment, so it's quite the evidence that it's working before we've got going.
Thank you. Well,
I think this is an enormous piece of work. It's obviously the first stage of implementing housing plan, an action plan. My question is around, in terms of how this has been set out, how far have you got with putting the resource numbers around in terms of costing, workforce planning, IT resource, for instance? And there also another question is that there seems to be no mention here of the Carbon Zero 2030 commitment. It is there for schools. It is there for a couple of other air quality reasons. So it's not on there on housing. It's 90 the building side, which is 90% of our carbon footprint. And then sorry, if I could just finish off by saying, is the dashboard is in this paper aligned to the same dashboard as in the next paper? same, we get one. Working papers.
Does talk about housing, low carbon neighbourhoods in Nottingham. We're
Yeah.
now requested on the estate that we are greening over the next few
Yes,
years.
we
But I'll ask, let the others.
If I could clarify that, we have 4/11ths of the time since that law was made. The question is, have we made 4/11ths of the progress? That's the criteria. Very good example of an estate, and I'm very happy to visit it. The question is, overall, are we hitting the rate we need to?
I'll hit the other questions. So in terms of the question around performance reporting, yes, they are absolutely interlinked. So the performance report that we will discuss shortly, providing open against the delivery of the current business plan, the future reports that will be an update against this plan. With regard to the resourcing around the piece of work, so a number of the activities outlined within the plan are activities and work already in the way within teams that have clear resourcing and plans around them. There are a number of commitments, particularly those around the cost-cutting commitments, which are new initiatives that the council will be taking on, which are being picked up and developed from a cross-council perspective and are being looked at in terms of the planning and resource around those at the moment.
Yeah, you've got to mention there of the workforce consultation. Maybe didn't start.
Thank you. That's again amazing to see what is planned for the next few years. I was just going to ask, how can we ensure we're delivering on all this and how often will we be tracking in terms of.
Well, Hannah, me to come in on that. So we will be bringing an update to this committee every 6 months as part of the corporate performance reporting, where we'll give an update against each of the.
Well, yeah, I'm going to go back to the police and policing safety. One of the things that is very clear, even it's really great that now we have 18 wardens and each ward out there on the gate. And it's great that working in conjunction with the police. However, the issue with the police is the numbers, but at the same time, distance and proximity. So our police all live more or less in one part of the ward in the borough, and they have to travel to different areas. Have we thought about maybe help them out by creating hubs where they can have respite
or some to a table
or be somewhere, because if to come all the way from Notting Hill. Yes, in one sense we are, because we're trying to buy Notting Hill Police Station, and that would be a hub where they would have a front desk and they could drop in. Okay. In the south, we don't have as many. So do we have anything? Can we work with businesses? Can we work with communities? So maybe create something? Yeah.
So the idea behind the proposal of those neighbourhood bases was that the Met would have all that they would need to be able to operate in the community. So they have their iPads, so they don't need to go back to the offices, and they're able to fulfil all of their kind of admin functions in the community whilst they're out there. So actually that should have aided the fact that those neighbourhood bases are closed over the years. I think the police recognise that they closed those bases at a time when there were shrinking numbers of police, and there was a MOPAC resource and asset strategy which was published up and anticipated that. I think my understanding is that we're considering that as part of a recognition that the numbers of police are forecast to increase in this commitment. And under the Met's turnaround plan, mentioned earlier, there is a commitment to increase the numbers of dedicated ward officers, those officers that we see on our streets. Certainly, it's something that we can speak to them about, and we only can see if there is a local need there, that we might be able to partner with them.
Maybe something we can pick up with the chief superintendent, or if he comes to our meeting next month. Plan.
I've got a few, if that's all right. I'd like to just first bang the drum.
Very all right, as long as they're
They'll be very-
questions
yes.
and not statements.
So Nottingdale Future Neighbourhood Vision is something that we are creating at the moment in Nottingdale, which goes to the greener point, and item 4 on page 209. It's worldwide. It's not only Lancaster West. They have their own future neighbourhood vision for Lancaster West.
Yeah.
It's now worldwide, and they have a heat network and so forth.
Fantastic.
So I just want to make sure that it's clear that this is a worldwide thing for the whole ward. My next point goes back to page 197. I probably should know this, but I would like to know what are the lessons learned from Grenfell that are referred to in 1.1, and where can I find them? Going to the police question, I'd like to see some support for the continuation of Royalty Studios as a hub, as a local hub in the Grenfell ward. And finally, looking at the safer KMC, and when we're looking at championing mental health and what have you, I see there is an investment there on a digital program of support, and I just would like to know what is the end space for like the outcomes from that, and how are we addressing the digitally excluded who may in fact be all the more in need. And just one more quickly point, the impacts of council services on mental health, such as housing, comms, transport, social care, and what have you.
With the Grenfell legacy, I suppose most of these things continue with the dedicated service, etc. The real legacy is how we behave as a council. I think we said again and again, it's not what we do, it's the way we do it. It's how we treat our residents, how we behave towards them, how we listen to them. And that has to go through really everything in the council. From the point of view, when we phone up the council to make a complaint or whatever, when he picks up the phone, it's friendly, it's helpful, that it's a one-stop shop, that you don't feel like you're being fobbed off. I think the whole culture of the council and how we change that and continue to change that over the next few years is really the basis of that legacy. That's one part, and the second is to be really the best we can be in every area.
And I've got, oh sorry, Will Fossey's
Yeah,
last
sorry.
question hadn't been
Yeah,
answered.
there was one bit of my question. If you don't have the answer now, I'm happy for you to come back. In the 4/11 time, having made 4/11 of the progress, particularly on housing, which is 65% of all our public.
Councillor really not being subject experts in all the detail. There's a bit of a theory of everything. We will
It's just
take
quite
them-
useful to have your questions.
we'll take them away to the specific services and then email them.
Okay.
I had a,
And also when it comes to the leadership team, I hope we'll have the answers then so that we can discuss them and bring them in.
Just, just going back to my previous point, just because I think the wardens and the CCTV are the main pillar of safer, which is sort of 1/3. So I think we do need to develop some metrics, and they might be qualitative rather than quantitative, so we know how we're going to judge whether they're successful. Because all my residents, they say, oh yeah, we want CCTV, we want wardens. We need to know also if they are making it.
But I just then add also in that case, we need metrics in terms of learning the lessons. As being the best is a one for
so my question, well, it's trying to get to me, is about the Congress, which I think other people have raised, between the council plan, action plan and the performance indicators. So I just didn't feel that they were as lined up as one might hope. And I'll just give you one example. On page 17, there was a 2.12, an aspiration to redesign hospital pathways. Funnily enough, that was one of the performance indicators that I thought ought to be in the performance indicators and isn't. And so then when I saw, having read the papers backwards, then when I saw it in the council plan action plan, that made it even more apparent to me, maybe, that they're not as congruent as they ought to be. I mean, obviously they're not the same thing, but perhaps there ought to be a little bit more matching, more alignment between them. And that would be my answer.
I think much of this is very detailed and aligned to the specific select committee areas. That's a good thing for us to go away and select facts more detail.
Well, I think the select committees will be asking for their own KPIs and performance, have already asked for their own KPIs and performance indicators, and perhaps they could consider them against the council action plan to determine if they need to be something. But let's move on now to the next paper, which is paper.
Before you move on, can I just ask one question? Actually, the whole offloading launched today. Will performance indicators then will they be the offload ones within this too?
Yeah.
Yes.
Yeah.
For the next meeting or in September or
For the next report.
for the next iteration. Yeah, as they just launched on the Saturday. Officer can't possibly have met. We can manage more than just something we should be aware of, that the whole, those performance indicators we are going to need to be able to install.
Okay, thank you very much. Right, let's move on to A7, which is the corporate performance report. And I think when we look at this as a committee, we're looking at it in two ways. We're looking about areas of concern, things, red flags that are particularly concerning, and we're also, as this is an iterative process, looking at the indicators themselves as a whole and whether we've got it right, which partly refers back to looking at the council plan, action plan. But this time I'm going to start in the middle. Lucy.
Yeah.
This time I'm going to say, Paula, do you have any questions?
No, sorry.
Yeah.
I didn't have any questions on this one actually.
Well,
Come back to in a minute. Yeah, well, this is one which might be better investigated by Family and Children's Scrutiny, but it was a percentage of care leavers engaged in education, employment or training, which is flagged red, and just the numbers have been going all over the place from 50% one quarter to 90% the next. Oh, sorry, page 333, first top line. So from 50% to 90% to 69%. And when we've got sort of a decent number of care leavers, it just seems like maybe we have a lot of don't knows, which is maybe why and also there's no decimals there, so it suggests a smaller number of people. So I think that's just something, because it's such an important thing that those care leavers are finding they shouldn't have gone into training. That's something which I think needs to be dug into a little bit more and find out, do we have the right data and are we doing enough to get that?
Maybe reply that to the
I think
to the
probably.
children.
In a way, I think this data set's working, isn't it? Because it's flagging up things it's simply for us to be able to say, whoa, there's a problem there. We need to refer it to the committee, we need to refer it to the committees and actually figure out what is going on. So
the traffic system works well.
Sydney.
Thank you very much. Just have a couple of points. Thank you for the dashboard. It was very good. On page 343, there were just a couple of things I wanted to make clear. The first one is on both the crime offences and the hate crime offences. It says in the what good looks like no target, just monitoring trends. And I think that we need to find a target from somewhere, whether that's from the measure piece or elsewhere, because otherwise we can't measure what's going on. No target doesn't work. Then secondly, the second one, which has got hate crime offences. I recall last year we talked about losing a budget item for supporting the work that's done in the borough about tackling. If we're losing revenue and we're not actually tackling it, how can we be certain that this particular area is going to be focused for us? And what are we going to be doing to actually losing revenue and we're not actually having a target to actually do them? Almost like say that the wind without any direction. So that overall I think it's very good having traffic. I think on page 343 there's a couple of good. And then the final point that I'll just throw in here, okay, Chair, that some of the It's difficult for some of my residents when I discuss this with them to understand what's going on, because normally going up is good and going down is bad. And you sometimes have green with a red arrow going up and down, and confusing. So you may want to look at how you're trying to describe something good with a direction of travel, so it makes sense to visually to somebody who looks at it on their eyes, but it looks as if it's red, green, but I'm not sure what's going on.
Yeah.
Thanks, Chair.
I wanted to comment on the missing indicators. So I was really surprised that adult social care only have 4 indicators. We have 2 indicators actually, and public health have 2 indicators. I found that really surprising. And one of the missing indicators I thought was the, how long it takes somebody to get out of hospital. I mean, that was just the obvious ones I thought of. I mean, given the number of indicators here, and I know that our KPIs and so on in our select committees will help us with that. But just as an overall corporate report, I think there ought to be more adult social care content in there. I personally was concerned there were no cycling indicators, that there were no, given that we're trying to be green about how much we've encouraged cyclists. I also wondered about some of the higher housing statistics. We use satisfaction, but sometimes satisfaction is not a good measure, because if you've had a lousy service and it got a bit better, you might see increasing housing satisfaction rates. But actually, I know from my own Brompton and Hanstown local housing reports that actually performance in terms of turnaround on repairs has deteriorated. That is not reflected in the indicators chosen. Well, I'm not suggesting there's any cover up, but just so happens it's not reflected here. So those are the 3 indicators that I would sort of present.
I suppose, and I'm sure we'll look at that, etc. But equally, you have to think about the indicators are against what our priorities are. And our priority probably active travel, but it's not necessarily cycling. Well, there'll be cycling in some streets.
There's congestion, and so I would have thought that encouraging cycling and people out of cars might be and cleaner air might be reasonable. But that's just a personal observation. On the other two,
we are, and it's set out in the cover report. This has sort of been a moving piece as we've developed this, but very new as this sort of way of doing it. We've been developing a council plan at the same time. We are this quite much up yet, but that we are doing a bit of a review directed by directorate, so that over the next year they will reflect what's in our priority. They'll also reflect what else. So I think the points you make about housing are really valid, and well as increasing social care. So that will be.
No, we totally appreciate that it's an iterative progress, and this is just our contribution.
And it's really helpful.
Maxine wants to.
And just to add to that, so in the new OPLOG indicators, there are 7 on adult social care, so including those. The other things in the OPLOG indicators that we don't report on here, as we do through the budget monitoring process, is quite a lot of stuff about the council's financial. There is 7 indicators about levels of reserves, about leverage, about the extent of borrowing and that kind of thing.
And adult social care ones as well.
Yeah, so
if you remember when we did this, we said we were mapping originally against. We did a fantastic job getting everything sorted. Almost against the last one, and now we got the new one. We need to do some tweaking. So actually, I think your comments are incredibly helpful, and any other comments that you have over the next few weeks will be good, because I can translate it. And so every time you see it, it should be more relevant.
I just wanted to add one further point, and that is that talking about targets, which Sydney really, I mean, when we talk about sometimes when we have lack of targets, I understand that. Sometimes it seems a bit pusillanimous. So, for example, around staff numbers, do we really not have a target not to have employ too many staff? I don't know. Do we have no aspiration to keep our staff numbers at a reasonable level? I think we really need to consider that, and that's not reflected in the blurb around. Much of this blurb, by the way, is really helpful in to consider.
Just coming on that, in terms of the development programme, in terms of looking at what measures we have, we'll also be looking at the robustness of those measures. So things like targets, tolerances, and also looking at the right contextual information as well.
Well, you wanted to answer.
Yeah, sorry, I'm trying to shorten my bit. First thing is, so really welcome the data, and when we're in select committees or working groups, we can go into detail. I'll come back with detail. First question is, 3 maybe is not the right number, but is there a reduced number of indicators? 1 page. You give us a rough indicator whether we're actually doing better or worse. When you're driving a car or flying an aircraft, don't look at the pressure over the. That's the first question. The second question is, are the departmental indicators mainly based on previous council? Or are they based on 23, 27 council? Because if they're not yet updated for the new council, by the departments, particularly in terms of cost cutting, major things. And the third and final question, should there be some kind of link up policy commitments applied here and measures with commitments of funding within the financial planning system? But should those things be linked up together? No point in having an aspiration measuring it beyond what we're able to do.
On the summary and the, I think it's the next ability point.
Yeah.
So when we first started this, always keep it indicated on the page, which can be quite impossible. But it is something that we've definitely talked about, is that in that we have all of this information available for our community to look at on our website. Also, there is also a sort of duty on us, I think, to make it accessible, because there's a lot. I think it's a really welcome comment, and it's something that we need to think about as we go forward and how we make this enable the community, because there's a lot to go through. So there definitely is something in that, and it is something that we're thinking about how context. I'll let Hannah pick up with the points around the
Yeah, of course. So in terms of the measures in here, so yes, they are the previous measures that were developed against the previous council plan. That's not to say that we haven't made some changes with this version of the report. We predominantly focused about reordering them in line with the new council plan priorities and made some additions and changes based on that. But part of the development programme that I need to talk to, that's what we'll be looking at now in the next phase, in terms of making sure that we've got the right measures that fit the council plan. In terms of the relationships with budgets, so we do have some financial information within the measures, and obviously we're bringing the report at the same time as the finance report. So there is a read across there. We can certainly look at if there are other areas we can make.
To read across the individual quarterly budget direction, medium-term financial strategy goes for 4 years. Has to at some point become a line.
Good.
Yeah, just very quickly on the accessibility point. We're using the right software as well. So if you have something which is really easy to drill down into 3 pie charts with green and sage and fair, and 60% green, 30% of measures around there, etc. And then you can drill down on it. So just navigability.
I'm going to draw this to a close because we've got something.
Can I just, before you draw the to a close, I'd just like to take this opportunity. A huge thank you to Hannah, who has just worked so incredibly hard on this. And honestly, I really think you've done an amazing job.
Also, Amy and Eleanor.
And this is some meters.
Yes.
I will not.
I was going to say a huge thank you on behalf of the Scrutiny Committee to Anita. But incredible amount of hard work, and particularly as a Scrutiny Committee, we are so committed to transparency, and it underpins everything that we do. And the work that you've done over the years to progress that really within the council has made our job easier, and your commitment and your work behind the scenes has been hugely appreciated. So we wish you a huge amount of luck. I'm sure Elizabeth will thank you another time. But thank you very, very much. A hearty thanks from us and to Hannah and colleagues as well for work.
It's been a real pleasure.
Thank you very much.
Thank you very much.
Right, committee, onwards and upwards. We're going to move on to, we're going to ever bobbing around still. Consider completely. Okay. So this is an update. I hope everybody's read it. Stuart, do you want to send me or the straight?
I'll have to go straight to question.
You've had to talk quite a lot so far. Who's got any questions on this? Stuart? Sylvia?
What?
Sylvia,
We'll
followed by.
start with Walla because she hasn't specific the last thing.
Sorry?
Yeah, okay, yeah.
Walla, off you go.
Yeah, with antisocial behavior, in some states, the way we do reporting, you call and complain, and then somebody get written up, they get a letter, somebody talks to them, and that's it. Initially, we were under the impression that people who persistently behave badly get removed from where they are. And because we have a lot of elder people, it really disrupts their life, the antisocial behavior. And a lot of the younger people who do the antisocial behavior, what they do is
So it's the question about removing them from the environment.
The question is, are we using the powers as we say we're supposed to use them, or are we not removing people because if you remove someone, you have to put them somewhere else, and you just more or less pick up the problem from one.
Sorry, well, is that our own council tenants we're talking about?
Yes.
Okay, thank just to clarify.
So I'm talking about
Stuart.
It becomes very difficult for elder people to actually live in an environment where there is constant antisocial behavior that just moves away when people come to push it away and it comes back.
So you'll appreciate this falls under the purview of my colleagues in housing, but I work very closely with them. And evicting someone from their property is an option where they are persistently causing concern and harm to the community through their antisocial behaviour. They have been given numerous opportunities to change and support if they have related kind of issues or concerns. It is a disposal that is available to our colleagues in housing management services, and it is one that they will use from time to time. They will use a whole range of different measures to try and change people's behaviour before they do that.
Yeah.
One of the recommendations of this committee was for me to raise with registered providers of housing, and as you will know, there's over 50 registered providers of housing within this authority, but to raise with them at the most senior level the concerns that this committee had, which came from the conference which was sponsored by this committee, and the feedback directly that we had from residents was to engage with those registered providers to ensure that they're using all the powers they can and taking all the action they can to bear down on these issues and concerns. And I'm meeting later this month with all the senior managers of those, not all of them, I have to say. It's those who will attend the Registered Providers Forum, which is hosted by our colleagues in housing. And I will be speaking to them not just about their duties and their responsibilities in that regard, but also about the services and support that the council via its housing management service, but also via its community safety services, can offer to registered providers in bearing down on antisocial behaviour.
Thank you.
Lucy.
Just a quick question. I was just going to ask, and I'm sorry if this has been in one of our previous reports, but the community wardens, what are the times that they go to? Is this an all-night function?
So they patrol 7 days a week from 7 o'clock in the morning to 11 o'clock at night. And they patrol the streets and public places, engaging with residents, but tackling those type of street-based antisocial behaviour issues. So littering, rough sleeping, begging, street drinking, idling engines, environmental issues.
Lucy, I can feel a supplementary question coming.
That's my worry is, I think most antisocial behaviour starts at 11 o'clock, and I live in North Kensington, and I cannot even tell you how bad it's been this summer. In the last year, I've noticed, to the point that I had a stabbing on my street this week. I just have never ever seen anything like it, and I don't think 11 p.m. is good.
Well, it's the police that we need there, Sarah.
Yeah, I don't know what pressure we can put on, but I just think antisocial behaviour is
Thank you.
very
Sue,
important
have you
to
got
our
any comments on
department.
that?
So I think it's a really good point, actually. And the type of antisocial behaviour that we experience at those times beyond 11 o'clock is often linked to drugs and alcohol. And there's there's a heightened risk of violence associated with that antisocial behaviour. We will be trialling a model of late night work between the wardens and the police later this year to tackle those type of nighttime issues. That's one of our commitments that I think is under 4.2.
Yeah, I can see that.
To trial that. I think the frustration with residency, there isn't a uniformed presence patrolling the streets at that point. The police will not be patrolling at that point. You'd have to phone them and they'll come by if there's a response, and if they've graded that to be of a significant risk that they will come. And I think that's the gap that we're trying to trial with our police colleagues later this year. But I do recognise that, but I'm sorry to hear that that's got worse.
Well, yeah, actually.
Thanks. The only thing I would like to say, I'm not sure if it's a question or
So, you know, I do like questions, but go on.
I'm not seeing anything here about looking into the causes of ASB, and I'm wondering if that is something that is on the horizon.
That's actually a question if you ask me.
It is a question?
It is, you're doing well.
Thank you. Yeah, so would looking at the causes of ASB be something that might be happening or planned?
I think that's a brilliant question. And the causes of ASB are multifold. And so if we know that some ASB is brought about because of drug dependency, problem drinking. My colleagues in the housing needs have a street population outreach team, which are there to engage with people who may be homeless and drug and alcohol dependent, and support them to get the support that they need to end their homelessness and to access them into substance misuse services, so that they can bring about those changes and they can change their behaviours. So there is an offer there, and that's not just for those on the street, those who are on the street, also our adult social care and public health, commissioning a range of different services in the community to meet those who are affected by drugs and alcohol. Not all of those within our on our streets who may be causing drugs and alcohol, may be causing antisocial behaviour, may be our residents. There's a challenge for us there. Our youth services by the detached outreach team and other services are there to try and engage young people, because I know that residents talk about young people and the concern around antisocial behaviour. And I think sometimes there's clear evidence of young people causing antisocial behaviour. Other times, it might just be young people being young people in a group. But I get that. That can be scary for some people. And the pernicious impact of antisocial behaviour is most acutely felt for those who are our most vulnerable residents, and they curtail their life around that. They're less inclined to go out in the evenings, less inclined to go out after dark. So we do take that very, very seriously. So I hope that answers some of the but I do think it's complex and it changes over time as well. So a few years ago, electronic scooters weren't a thing, and they weren't an issue, and they weren't causing this concern to some of our residents, but they do cause concern to some of our residents.
Thank you. Portia, you got any questions?
It was based on the same question.
Thank you so much. Will?
I note it's not so much in this paper, I put it together with comments in the paper for last. I note the progress on joining up ASB and FREST with the consultation start at the summer and the fact that the IT backup is still a work in progress, would it be useful for us to have a further update on this subject in 3 to 6 months' time? Particularly on that, how those things go out. Is that
we can do
appropriate?
that by circulation. We don't necessarily need.
Because I've been trying to push for it ever since I've stepped to leader, so it's taken an awful long time.
Yeah, thank you, Chair. In terms of selection criteria and training of wardens, what is that, particularly regarding ASB?
I'm not super close to this.
Okay.
I will say that in the first instance. However, instead of there being an interview, there's a training day. So the wardens who are recruited collectively together, and they're taken through an interview. They're taken through role play. We encourage wardens as part of the recruitment to come from a variety of different backgrounds. So we have wardens who've done lots and lots of different things because we value the broad life experience that people might want to bring to that role, who are interested in giving something back about making a difference within the community. So we will take a broad church in applications. We run through a process which looks at how they may cope in a number of different situations, and that will include role play, problem solving, and interviews. And in regards to training, there is a range of different training programs which we put in place, which will include kind of basic customer services, will include specialist knowledge around antisocial behaviour tools and powers, use of equipment, de-escalation of conflict. There's a range of different training programs. We are actually considering, as part of the consultation that Councillor Pascal mentioned, a formal community safety qualification for all of our wardens in the future. So that's being considered as part of the request consultation at the moment.
Thank you.
Thank you, Chair. Just a couple of quick questions. First one you mentioned on page 410, bullet 3.3, a co-designed web page to triage. Is it possible that we can have something where residents can put up, I've seen some antisocial behaviour, goes through to a central repository in your team, and then your team can then deploy people to go there? And I ask that request because I'm on a WhatsApp group with about 50 residents. They're constantly seeing antisocial behaviour, like very similar to next door. They don't have a way to go through to the council, so the council community safety team can take action and react. You mentioned street drinking, but I don't see on your list of 3.2 licensing or licensing enforcement. And notwithstanding the fact that some of the problems that we heard about at the Antisocial Behaviour Conference and the Chelsea Crime Summit with Greg Hands MP and the Superintendent from the Met Police, street drinking is a problem. And therefore, if we're going to try and target the areas where there may well be the most antisocial behaviour, will you allow councillors to help and assist you with potential problem areas, direct the wardens to, wardens have sort of a roving brief? And the final point I wanted to mention was following up on Councillor Knight's point in terms of timing. If you're going to have, and we've seen it after, say, Chelsea football matches where there's sort of 3,000 people standing outside a pub and the rest of the Metropolitan Police are dispersed, it's clearly a problem area. And we need to sort of think very carefully about how we tackle those very real issues where people in wheelchairs, people with pushchairs can't walk on the pavement because there's 3,000 men standing there drinking. There's a huge problem. I know that you are tackling it and taking it very seriously, but I think.
Thank you.
So I'll just come back on. So the last one, first of all, the football, that's very much led by the police. We've brought a challenge to the police on concerns which have been raised by councillors, by residents and ourselves about how they police those matches, and we'll continue to do that. Licensing, our colleagues in licensing work very closely with community safety. We have a weekly tasking meeting where we capture all of the latest data as we understand it from not just police data, but from all of our council services, and think about where we need to put our resources each week. Licensing are absolutely integral to that, as well as the more strategic problem solving core that we have. And in response to the first question, I think yes is the answer. We will be looking to ways in which residents can quite easily report to us a concern. We want to do that safely. We don't want residents going up and photographing people or putting themselves in danger, so we need to be thinking about that. But we need to find an easy and slick way for residents to be able to say, there is a problem over here, and then we can respond to it.
Thank you. I think we've added a number of sort of thoughts and concerns to the next steps this evening, which I'm hoping the minutes will capture carefully. And of course, we're hoping to have something with the duty superintendent in September. This is never going off our agenda because it's very clearly a huge concern to residents and obviously to members of this committee who seem to do it. Thank you very much for coming and taking us through that so far. And let's move on to paper A9. Do you want to be introducted or so we can start straight?
I'm
assuming everybody's read it and so on. When shall I start with questions? Sydney, shall I start with you?
I've nothing in this.
Nothing on that one, sure.
Yes, my question was how this would link into the council plan action plan, and do you have any specific KPIs to measure performance by, and also has this been costed?
So in terms of the first question, it's directly linked into the council plan action plan. So in terms of the overall council plan, under the fair and seeking social investment approach has been added into that. So the initial engagement that we did was in regards to the fact that it needed to align with council plan priorities first and foremost. And in terms of the action plan, the aspects of fair and social investment approaches with aligned to. So we will have regular meetings with the corporate strategy team and also other internal offices in terms of where that fair thing can be applied. And in terms of the KPIs around that, there is already discussion with internal officers about what that looks like for their particular departments. Why I say that is because this is an approach, so therefore we need to be having conversations to talk about KPIs that are appropriate to them in terms of the social investment approach, and they'll be both operational and social impact based. What might I say about operational? Mean things like how many social investment activities are happening within your particular area that is aligned to the council action plan and our fairer aspect is one, and then two, the kind of measurement around that in terms of the KPIs. So how much social value, social impact is being created from that particular project that we can then kind of report on. That's what's mentioned on the last page in regards to the kind of almost annual report that we're hoping to have in summer 2024. So you'll see kind of operational KPIs. And the reason being is because we're quite clear to make a focus that it's a council-wide approach, and therefore conversations with internal officers should always be about kind of what they're doing, their different projects, things that are already happening, as well as from our perspective, what more we can create. And then the second KPI would be around kind of the social value and social impact created too.
One final thing, you didn't answer.
Oh, apologies. And then in terms of the cost aspect, so there's a conversation with initially with property colleagues about what that will look like in terms of income in regards to social investment leases, and that's likely to be almost low cost because it's more so looking at what finance looks at in terms of places where I see things like audit mitigation, or in cases where we're looking at working with BCS-based organisations, where we can just put the framework around it so we can see what impact that they're having. So it will likely be historical relationships with organisations already in place, but what we're keen to do is be able to show the impact that they're already having based on this social investment framework.
And substantial report on this in a year's time.
Yes, we're able to start 2024.
Thank you. Well,
yeah, about libraries.
Yeah.
We had a visit to libraries and we've seen almost all of them, except for Notting Hill. And it seems like the offer we hoping to give, where we use the libraries and turn it into a really a central hub for the community. Not every library is on board, from what I gathered from my visit. Do we have we have that in consideration, that different libraries can become different community hubs?
Yeah, so we have that in consideration also for the different needs around the geographical location for those libraries as well, because our libraries are in very different locations, and therefore the people that visit them are likely to be people that have very acute needs. So when we're speaking to library teams and officers, those conversations are already started, but exactly what we're talking about. The idea is to kind of think about how much usage we can get from them, both for our communities. But the idea is that, of course, if you get more footfall to a library, it's also getting more usage. And at the same time, when someone goes, what else can we add there? So it could be a push to read a book, but could there be something else there that also gives usage to residents? And in terms of those conversations, it's not just with officers, it's also with things like friends of those particular libraries as well, and particular local groups. Just so it's important that they, from a transparency point of view, but also from any kind of co-design point of view, that their input is put into whatever happens in those libraries, because that's the thing that made. And although we're keen to make them community hubs, it is ultimately important that residents, one, are visiting anything we do in those libraries, and two, that the process is transparent.
Yes, I do. Page 421. I was just intrigued by your approach to making the council resources to benefit your residents. How will you do that in practice?
So in terms of the way the overall pillars work, the 6 pillars that we're talking about, decision making, the idea that social investment is embedded across the decision making. And what we mean by that is financial outcomes balanced with non-financial. And that's from a historical context, both from Grenfell, but also from the Kroll report, where there was a consideration of some decision making, one with libraries, but also in terms of property decision, did not necessarily consider where we might have been able to have overall value for the community. So in terms of decisions, when we work with officers, the idea is that we are at the table as a team to be able to support them in any kind of potential decisions where we could get some social impact and social value from our residents, but also as a facilitator of any other potential areas of increased impact. So for example, if the libraries team or the property team came to us and said, we would like to do something, but we're quite unsure, it would be our team working with other teams to think about, okay, we will start the process to go out and speak to residents to see what they might like to see here, what could be needed, and what are the organisations within the borough that know how to do that, and then also engaging them, one, in the co-design process. So first and foremost, what would you like to see? And then also thinking about how we can do some co-production as well. So could we empower them in that process? And could we think about what else could be done to really benefit the residents? So it's a whole approach across the council that we're working with officers to make sure it's embedded, and that will be across all decision-making processes. And that's why, if you looked at a lot of the pilot case studies, the idea is that we as a team ultimately work with those resource areas. But in fact, of course, you can see there's a property team, there's a libraries team, and we are there to ensure that at all times, and hopefully we can derive some level of balance of financial outcomes and all. That answer your question.
Thank you. Thanks. I just wanted to ask something about partnerships.
Yeah.
Page 45. Clearly, obviously, partnerships are really important. This is how we deliver so much of this, and sort of informs and underpins what we're doing in the strategy. And I was just wondering, is there anywhere a sort of comprehensive and transparent overview of the local partners that we have?
So I would imagine that there is, in terms of what it would depend on what we would necessarily first and foremost towards partners. So in terms of that partnerships pillar, it was more in terms of anchor organisations that we can work with that have the influence, or potentially, as was mentioned in that particular area, as the example given, the land, to be able to have a real effect and be able to benefit our residents. And then that conversation then widens out into the likes that also do quite significant amounts of work, such as organisations like the NHS as a prime example. That list will continue to grow. So we do have a list that we've spoken to other officers about in terms of what they consider a partner. And at some point, once that list is longer and exhaustive, it likely will be shared in terms of what we consider a partner. But from our point of view, that's something that over a long amount of time will continue to grow. And just by the nature of a new VCS will suddenly pop up that's very popular with residents, that therefore suddenly becomes a very important partner within the community. So there's kind of those key obvious anchor organisations in terms of landowners, large VCSs, organisations that support our residents. But we're keen to also work with residents to see about the ones that we don't necessarily know. So partnerships will always continue. And we started those conversations already, both in the north and south of the borough, where we said to residents, can you tell us people that are doing really good things and about how we can augment and improve their impact?
Thank you. My comment was on page 420, the bit in blue. I think I'm not sure what that's supposed to be, whether that is supposed to be the mission statement or whatever. I wasn't sure it's entirely grammatical. So that was a bit of a worry, and I wasn't sure what the difference between community benefit and social value was. I don't need to answer any of that now, but just sort of to think about. But overall, I was underwhelmed by this strategy, I have to say, and obviously not an opinion shared by my colleagues. But I think I just felt it was very, it was very thin, and I wasn't sure how we are going to evaluate social value against commercial value in any one instant, how we're going to be consistent in our approach without those kinds of guidelines, how we're going to embed it within the organisation without more structure to it, and how we're going to avoid, I mean, potentially there are threats of, if we don't have a more consistent and structured approach to it, which I just don't see here, how we're going to avoid judicial reviews, for example, if we make decisions about things, about allowing not allowing a charity, for example, or allowing a charity to have something. And that sort of does concern me. I mean, as far as I know, the only really consistent and structured approach we have to social value is in the procurement and commissioning strategy, which is alluded to here, but not very clearly, where there is actually some suggestion of the percentages and so on that might be deployed in this area. So I would just register my concern. Perhaps you can, say how that's going to be addressed.
So in terms of that, because it's an overall approach, the feeling was that the strategy needed to be something that almost outlaid an early roadmap for different departments about how they would go about doing social investment. So it's not the case that it's a strategy or a strategic document that's going to tell them what to do. And from internal conversations, both from engagement with residents, but also officers, that was something that they felt was a healthy step, because it's something that needs to be embedded themselves. What you'll likely see then is other strategies around those aspects that will have social investment considerations with them, be that an overall property strategy or the library strategy in terms of what they see next. Because it's an overall approach as opposed to us directing different teams and telling them what to do. It's more so a guideline about how to go about social investment, what it might be, and then it's up to those particular resource areas to decide and work with us about how to go about that. It's not an all-encompassing document in terms of how we will do that, and that's simply because by the nature of the different resource areas, they're very different organisations and different ways of working. So yeah, you raise a very valid point. In terms of procurement, it's very much in terms of a social value metric that you might have on a tender or in a bid, but that's not something that's necessarily considered on our parks or within our partnerships.
So when it comes to procuring services,
but then, and that's of course the case, but in terms of the approach that then only limits you to procurement. One of the things about the approach is that we're looking at areas where we can really use our assets as much as possible to actually create a bit more social value, social impact. So what you will likely see, and we are already working with teams in terms of their overall larger strategies, will be considerations of social investment and talking about it within their own strategy.
So I think what you're saying is that this is a strategy for other strategies to measure themselves against.
Yes, and in terms of the
KPIs, I haven't thought of it like that.
There'll be a
start with, but I will read it again with that in mind. But yes, I'm not sure if it achieves quite that. But thank you for that explanation. That is a clear explanation. So then we'll have another bite at the cherry then. Thank you very much. Any other questions? Before I say thank you very much. Thank you, kept you so late. I'm keeping others even later, if that makes it better.
Thank you very much.
Thank you. So now we've gone to the huge assignment of the evening, the MTFS. You've been waiting so We've got Johnny, which is right, thank you. We've met Amanda before.
Yeah.
People watching this online.
Welcome to Liam's habitué. That's a piece of enjoying. Thank you very much. Do you want to give us a quick intro?
Well, I think definitely the NCFS is a very strong paper and it sets out our position over the next 3 or 4 years. I think one of the things that's different about this year, which I think is useful, is that it expresses a best and worst case scenario. So that we have, and those are still assumptions. They are uncertain. The best and the worst case may not be precisely those figures, but it gives an indication of some of the uncertainties at play, and some of the things that we'll need to make a judgment about as we set budgets, because the judgments we make are what the gap will be, and therefore what we need to do either in increasing our revenue or making savings in terms of services. So I think that's helpful because I think a single figure can sometimes feel as though it's set in stone, and sometimes the assumptions therein change quite dramatically in year. So it tries to give a flavour of that. Otherwise, I think overall the council's finances are in a strong position, certainly relative to other London boroughs that I've observed, which is to be welcomed. And as I always say, in part to the good stewardship of people that have held this place before. But then other than that, I think res ipsa or res pecunia loquitur, I should say. The money speaks for itself in this paper.
I agree. The scenario modelling is all scenario setting out is very helpful. Who'd like to start off? Sydney.
Sure. Thank you, Chair. Thank you for this paper. I want to dive straight into 469, which is look at business rates on the paragraph. We know that businesses are a key part of the fund and we want to support them, and it does mention a package of support available to businesses, and I want to get a bit more clarity there. What we're planning to do related to businesses specifically.
Thank you for the question. So we will obviously support individual businesses. We've got the reliefs that we can offer. So it's not, can't say the one answer how we consider it. I think it's what we'd ask each business if there's problems, contact us through the business reps team, and then we can provide support for them individually.
Yeah, we get business hardship applications pretty regularly.
We do.
As well.
And we look, as I say, we look at them on an individual basis to see whether they qualify support from us.
Yes, I have 2 questions.
So I said very crisply.
The brevity is the soul of wit.
Yeah, short interrogative statements and questions.
It doesn't have to be fun.
No, so just because I wanted to follow on from Sydney's question, when we give rates relief, what percentage of that hits our bottom line versus covered by central government? We have to give it all ourselves.
So we have a system detail that I'm not close to. Don't people have their mind department. So what I can do is
we're giving away our own money if we're not giving central government.
So because it's business rates is a percentage related.
Yeah.
We pass on to the government.
Yeah.
So would be some of our getting more.
Okay, but what we give away is in proportion. Is the
2/3,
ratio?
1/3.
It's
Our 1/3 is the council's money and 2/3 is the government.
Yeah. And we built some of that into our budgeting.
But is the relief 2/3 the government and 1/3 us, or is the relief 100%? Okay, that's okay.
I think it's right, but I want to check just to.
And then the second point, which sort of, I don't know if it's this paper or the next paper is the most relevant point, but in terms of borrowing, because there's various things in here about interest rates facing future borrowing. In terms of money we currently borrowed, how much of that is either on variable rates or is coming up for a rates review? Because there's lots of
companies at the moment who, like Thames Water, are in a lot of trouble with variable rate loans. What's the impact of that for us?
So this is going to sound like something else. Apologies. I'm not sure of the treasury.
Yeah, it's on the
I do have some detail. I'm going to bring William in.
Yeah,
It's 99% fixed.
Is
So,
it?
yeah.
over what period?
So that varies as well.
Yeah.
Yeah.
Yes, so some maturing in the next 18 months. So no, so it's 2040s, I believe. We can get the detail.
Good to know how much is maturing in the next 12 to 18 months.
About 12 million. Out of 200.
Okay. Okay.
But we'll get these.
Yeah. Thank you.
Well,
Questions. Is the MTFS linked to the previous council plan, or is it linked to the new council plan? MTFS is 4 years. The council plan action plan, that's out the first 2 years of the council plan period. So is it aligned with the new plan, or is it aligned with the old plan?
Along with the new plan, and the work we're doing now to close that. It's the same as associated in the category.
And some allied to that is presumably the infrastructure on front end will change. Plus, like, presumably built into the process up to that.
Yeah, so what you can see in the table is obviously much greater in the second year than in the first.
The second question is, if we have the MTFS risk register dashboard plan, previous and current, why did we not get enough forward flagging of the shortfall in the HRA, mainly in capital, but also current, and also the stress that's been put on the general fund budget? Why were these not flagged up in the past?
The HRA has been identified previously pressure for the council. As you know, we're bringing a report back. Business plan, I think temporary accommodation was identified during the financial monitoring in 2022-23, and you can see the overspending. We built some growth into the budget, but now just growing greater than we expected. Associated with.
Final question is, do you think we should have a fund that policy commitments are being costed?
In most cases, I anticipate that would be the case, yes.
They do that already. And it's all to do with the procurement relationship.
Yeah, so it's will be developing strategies for so on policies and everything around this part of that development process.
Maybe bring us more detail when you.
And we're bringing just
In the report, if we can have a bit more on.
Oh, no, I'm just going crazy and I'm going to go to Claire next.
Thank you. Just not one, I think, which is, I'm looking at page 475, where we're talking about dental and the claims. And I'm just really wanting to ask, how much of those claims will be fully covered by the capitalisation? And of that capitalisation, which the revenues come from council tax, how much will residents of the borough and in particular be in fact effectively contributing?
So the capitalisation is a request to use borrowing to pay for that. And the plan is, because we need to pay the monies out quite soon, we've asked the government to look at request. The idea is
cover those monies for other, in the future, which will then pay back that level of borrowing.
That's quite sort of a longer, slightly longer term. Thank you for that.
Thank you.
Paula?
Yes, I have two small questions. One on page 473. It's about the COVID recovery and cost of living pressures. I'm wondering how close to how accurate are those figures now? Because I'm pretty sure when we started looking at these figures, with the interest rate something and with inflation is one thing, and now things are different. So is that also included in what you said earlier about you have the best case scenario, worst case scenario, or how are you mitigating having to deliver something when you planned it? The financial environment was one thing, and when you're delivering it, it's totally different.
That is a challenge for us, and that was a challenge here. So obviously, that's set, start of the year, and we saw interest rates change over the course of the year. The numbers, as Councillor Francis said, point in time, best and worst case scenario. We won't have the budget finally agreed until February 2024. So we'll keep on that to bring on those interest rates and any other changes during that period. So they may need to increase or change, but at the time of writing, this was related to the rates that we were aware of.
And my second question is in page 476, which is about actually our largest single source of income. Are we still collecting as much from parking as we were, for instance, I don't know, 3 years ago, or is it better? Because I see less cars on the base. I don't have to look for a parking spot. I just want to make sure that's possible.
Parking for cheap in relation to the outcome.
So I think going back, if you asked the question 3 years, would be cool. So probably best we take that away and get you a detailed answer on that. It's increased and improved since previous year because that was the year of the pandemic, but I don't have the personal, I don't know the history, so rather than answer it now and give you a wrong answer, but
And also, since you're looking at it and coming back to us, can you also find out if is it people changing cars or people moving out or giving up cars? Is there any way you can find out?
More roughly, in the time I thought the number of residential permits about 2% here. So that's a ballpark. It's not fact at the moment. It should be roughly around there. So you're right, there are fewer cars on the street. Structurally, that would imply a declining increase. There are some things that may affect that. So, for example, the diesel surcharge and the electric discount, depending on the rates they're set at and how you vary them year on year, can affect income. We try to build in some of that stuff into our assumptions. So our budget should be robust and balanced, even accounting for the trends that we can foresee. Parking income has improved, or rather has increased since the pandemic first. And I guess following on from the list a few moments ago, which is that parking overachieved in relation to income relative to the forecasts that had been assumed a year ago. And so the recovery of that income stream, such as it is, has been better.
So is it the number of cars increased, or is it because we increased our cost?
We'd have to take that analysis away and confirm whether it's a number of permits gone up or if it's as a result of the struggles.
Well, or it might be that the number of permits, but it also might be the number of permits that are lost than might be the state. Rather, the decline might be slower. There might be more tickets issued. There are lots of reasons why that could be. So I think you're right when you take play.
I've just got a couple of questions on ASC grants and the Better Care Fund, just because on page 4, 6, 7, you say beyond 2020, board planning remains uncertain. The financial plans will be assumed to continue at the current level. And then on page 474, you say furthermore says there is a risk the service budget in 2025 the grants are not maintained. Just on those points, which I'm not that surprised by that understanding, when actually we might have an idea of when we would hear sort of confirmed. I mean, I'm sure it's Sarah's worst nightmare, but when we do normally hear.
So, yeah, it's a really good question. When we hear, it can vary. So at the moment, we were missing funding from social care. 425 was funds in our worst case scenario. We usually get before Christmas the draft settlement. Yeah, I would expect there to be some indication, if not finalised and confirmed in that, and then that settlement is confirmed by Christmas. There will be a lot of pressure from a lot of sources to continue that grant funding beyond the 2-year period.
So they should deliver it.
That's correct.
Father Christmas is not the Grinch, is all I can say. I suppose my only question really was just to the 2% payoff assumption and the 4% contracts assumption. Is that realistic, really? And do we have a better grip on the inflationary terms in all our contracts than we did before? So I think at one point there was a concern that we couldn't sort of press a button and work out what the inflation terms were on our major contracts very quickly. Therefore, what we, which ones protect us from inflation? Of course, they don't always anyway, because the reality is we don't want them to get past.
So I offer we are still in negotiations around the year 23, 24, and we built 4% assumptions for that. We think that it would be more, so we built some assumptions in for 25 to additional element. We have to just keep a really close watch and brief on it at the moment as to what it might be 24, 25, but 2% probably given where we're at the moment would be too low because I think rejected.
That's in my
rejected it for.
I mean, these are all guesses. I get that, but I would just say, as a guess, that wouldn't be my guess, is what I can say.
And then the 4% contracts again, it won't be 4%. Lower. Those contracts we have done some work on major inflation. Again, sometimes you see pressure from contractors asking for us to vary,
even if it's not in their contracts.
So all of these things, as I said at the start, are subject to change in years. That's why I think we're in a good position. As we said, that we understand where we need to just keep a really close eye on all of this over the summer. And
we'll have an opportunity to do that as well.
Yeah,
that's
I think what I would say is actually 24, 25. So next year it's got quite a small gap compared to the following year. So we should be looking longer term in all of this.
Transformation work is important. Good, thank you. Well, should we move on swiftly on to paper A11, which is the financial outturn, which obviously is outturned in the right direction. So before we begin paddling and criticism, we should just thank our lucky stars that it's an underperformance in expenditure and not overperformance. But can I test colleagues? Well, do you want to start?
My question is that mostly due to slippage? Was it to do with costs actually being low?
No, I mean, it's primarily three things. One is service underspends, which relates primarily to the overachievement in parking income talked about. Right. The other is partly slippage and partly overachievement investment income. So treasury matter. And the third of the three is I don't understand largely. So those three components have resulted in a pretty in the outcome.
Thank you, Chair. Just a quick question. Page 617, bullets 1.12 and 1.13. I just note the reserves reduced from 196 to 234.49. That's a bit about that. That actually continues, of course, the trend would be.
So, thank you for the question. So 1.12, the reserves position in the general fund, if I can draw your attention to table 8 on page 635. What you can see there is in the first column of figures is the opening balance for reserves. You can see the movement in the closing balance. And the big movement is a reserve for collection funds, and that's a tiny lift. So actually, if you strip that out, the movement is 36, that's 38 million of it. Share. And then the other question on 1.13, capital reserves change on 1.13, reduced from 234 million to 159 million.
636 on one of the shadows that we observe. I'm asking the question about with 1.13, the reduction in the capital reserves, which is explained in table 9 on page 636. Just talk us through the capital receipt reserve, 47 million there, which seems to be the bulk of why we reserves reduced so drastically. Fixed.
Also set out in 1.13. It's the 7, the overall figure. Yeah. It's bringing down by that wide. Yeah.
So, Chair, they said they're going to come back to us on that.
Yes. I think, yeah, well, I look forward to getting more detail on that 85 million reduction in reserves. But my question is about the environment and communities underspend, and it said that some of that can be utilised for future projects, including City Living Local Life. And I just wonder whether that could also be used for NSIL, and maybe it's a broader point. I've never really understood why we have City Living Local Life and NSIL separately, and one's supposed to be revenue and one's supposed to be capital, but the reality is, yeah, but for the ward purposes, I think we wouldn't have to worry about whether it's a capital expenditure or revenue expenditure, as far as we're concerned, with the bottom money.
Well, the way that SIL is allocated is set out in the national guidelines. There are regulations that govern that. Also the amount in terms of how it comes through, because there's a SIL charging schedule in every area. So the amount of SIL that we collect is based on that. Yeah. The ways in which it can be spent is also set by that. City Living Local Life is very different. It's council money, as it were. And I suppose we could ensure that the two funds have the same guidance associated with them and therefore can be spent in coherent ways. But that would be a restriction of City Living Local Life, because you can't expand the criteria associated with still.
Okay, so NSIL is specified nationally. How that
Yes,
can be.
It comes from
Perhaps
planning.
the useful thing then would be, say, city level local life, we can spend it, anything we can spend NSIL on, we can also spend city living local life plus
City living
additional
local life
things.
is more flexible.
Well, yes.
Because I've been told before that I can't spend city living local life on capital.
Yeah.
Yeah.
Yeah, that's true. I mean, it's really, that's a policy question, probably for the legal
It is,
community, in the sense that it would be a widening criteria through which you can spend city living. In principle, I suppose you probably do that. It would just be a change of purpose or use for that fund.
Yeah.
But it may be something that we want to take up with the legal communities in due course.
Thank you. Yeah. I mean, I suppose I just thought the outturn of the temporary accommodation, just to revisit that, continues to be a huge concern. I know it's on the risk register, but it's worth us just I suppose highlighting our concerns to the leadership team about that. And just the only other item was the capital underspend, 20% capital underspend, which is a constant feature in this council, and we keep hoping we're going to get more of a grip on it. Are we getting that? We've talked about pot slicing, we've talked about various approaches. I mean, not that it, the point being that maybe we'll have to do cuts one day, which we wouldn't have to do if we got to that.
So we have put in place a rapid program where people are doing a lot more rigor on this scheme from the very start. So I think there's part of the reason for slippage at the moment is projects are entering the capital program too early, and therefore not spending and therefore slipping. So that's a bit of a changing approach and changing behaviours that we need to start to develop, so we don't put them in too early. And that team that's been set up is working on that. So it's almost from the start of inception of a capital scheme right through to the end, so making sure that actually if something gets into the programme, we profile it right as well. And there will always be slippage due to the nature of the schemes. Things don't always get factored into plan. When schemes get on site, sometimes there's something that delays the spend. But we certainly are trying to look through it. I don't want to say we've completely nailed it. We will be in the pudding at the end of the year. But we're trying as much as we can.
So we know it's not chestnut, but we just sort of have to make the comment.
Yeah, right. Because the other risk is if those schemes are funded by borrowing, and you borrow too early, you incur costs with borrowing, which obviously we don't want to do. So we need to try and get that.
The reverse of that is the slippage in capital has been well. So there's a trade-off between delivery and
but when we come to tight budgets, we don't want to over budget for things and cut things that we really would like to carry on doing. And that's but we're not there yet, so I do appreciate that.
Chair, do you mind if I just come in on this one? So I think Lisa is describing the kind of financial rigour that we will be bringing to that program, but there's also obviously the delivery rigour that we need to bring that aligns with the financial. So we've looked across our capital programme, and I think we are under geared in terms of the technical discipline programme management that we apply to it. And that is also uneven. So there's some good practice. I think one space has been really highlighted. The housing plan maintenance programme is actually happening at pace now, which so it's sort of other parts of the programme that are likely behind. So we're bringing all of this together to get to a place where projects. So some of it is about gateway, but some of it is about pace when we're on site. That is true. So yeah, council about the. I think we can bring the presentation, but that is, I think that's the HRA capital there that then is planned spend
So the way that the HRA works is that the money is built up to spend on the capital programme. Now that the capital programme of the HRA is motoring, then that money reduces. That it doesn't if you've got backlog loans.
Thank you, and it's reassuring to know that there's high level concern about our capital programme, both from me and from Sydney.
Just one final question, just on page 662, that question about the street scene improvements claims were underspent, 85% of the money hadn't been spent. I just wonder why that one particular wasn't tackled.
I think from what I've heard in the round is that's a passive percentage of the day. But we can say that yeah.
Thank you. This is passive funding. I was also,
yeah, I believe that's the passive funding. Yeah.
That's Sloane Street, not Sloane Square, surely.
Sloane Square on it.
Yeah.
Yes, I would have thought that, but I think it's a project of Sloane Street, so I wondered if it was another project.
I'm not.
There wasn't enough detail for me to understand what it was.
Exactly, I'm misfired.
Yeah.
Good. Other than that, I think we can. Oh, sorry. I thought you said you didn't.
I just wanted to
Sneaking in.
something that Maxine has said. In terms of the capital reserve reduction, the capital reserve generally is different from the capital within the HRA, right? The HRA reserve is through both.
There's two sections of capital.
Is
So
that
you've got general funds,
Yes.
capital, and you've got
Yeah,
The HRA is ring fence.
yes, exactly.
Yes, so I wasn't,
no,
yes, so
so
the
I
ring fence is there.
So I suppose I'm just wondering still, do we not have an answer for how the more general capital reserves have reduced from 2.4 to 1.49?
That was that election we got.
That's the one I'm
Right,
asking.
okay.
that's what we're going to take away. It's not infection funds.
Oh, right.
That's general funds.
Okay.
Can I,
Yep.
just because, sorry, I just spotted one thing, might be, it's probably something to take away. But Chelsea Barracks,
6664.
yeah, sorry, page, yeah,
664 halfway down.
664 halfway down. There's a project called Chelsea Barracks Section 278 Works, with 282,000, which we weren't expecting. So I was just wondering, what is that? And I thought Chelsea Barracks was in Westlands.
We'll come back to you.
Yeah.
Lovely.
So even to determine what's the issue planning highways.
So yeah,
It'd be a
and
highway
Chelsea Barracks is
improvement.
bordering the bus, so it's although it's
okay, yeah, if you can keep
Thank
study
you.
smooth, that'd be great.
Good. Thank you very much for coming and saying all that so clearly and agreeing to come back to this on items. Thank you very much. Item A12, which is examining our own labels, our agenda, our annual scrutiny work programme. So are we missing, do we have a supplementary sheet for adult social?
On chair.
Perfect, good, excellent, everyone's got that.
Yeah.
Yeah, I've got one.
So do you have this?
So go on to you.
Tom,
So go on
Tom,
to that.
yeah.
Yeah, okay.
One more.
Thank you very much.
There were two.
Yeah.
This one over there called. It's email around this.
So, first item on this agenda essentially is to agree our annual work programme, which is detailed in Appendix 1 and the additional paper around the table. I think it represents, I mean, all the select committees have reviewed their own and recommend them. So what we're doing now really is looking at them in the round and checking to make sure that we haven't got any duplication or spotting any synergies. And I think it looks a good spread. I'm very pleased to see that every select committee's got a working group this time. And I know that there is also, aside from all of this, a firm commitment from each select committee to have a round of visits to institutions within their bailiwick, which is good. But can we agree this work programme. I'm sure everyone's read it.
Yes,
Good.
yes.
Thank you very much. And then the next item is the budget scrutiny arrangements. And this year we are going to provisionally agree ahead the terms of reference of the budget scrutiny group. The budget scrutiny group will confirm those terms of reference at their first meeting. And the reason we're doing that is the appetite, particularly from the chairman, laudably, to get going as soon as possible in the summer, so that we've got a good time.
If I could just explain where that language came from. The Centre of Scrutiny is encouraging, and the Citla Code also encourages us to do a year's programme of work rather than starting in the autumn. So that's where it came from. So we should actually get particularly up to speed with the officers' input before we get into the serious debate within the Scrutiny Committee.
So the first meeting will be in July this month. So then we also have to agree the membership of that committee, and I know that we have the chair of each select committee, except adult social care, where I understand that Councillor Hargreaves has attended as a member of the adult social care select committee to deputise for Lucy because she's got so much else on her slate. I gather we're going to invite Councillor Wade.
If she wants to, yeah.
We're going to invite her to
scrutiny.
join.
So important.
And yes, so Claire is definitely joining, and I'm going to join the scrutiny committee as well now. Now I've had a year off from doing that. So are we all happy with that membership?
Yeah. So I'll email round about a meeting.
Brilliant, and obviously Will is chairing it again this year, which is great. Thank you all for doing that for us. So then we move on to the agenda item A13. I don't know if I'm interested. I'm doing chronological factory. So here we're reviewing the forward plan of key decisions. Remind everybody this is a vital function that we do because it gives us a chance to comment on those key decisions. So if I call through the pages, anybody on page 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, I'm done this now, 16, 17, 18, 19, 20, 21, 22, 23, I might do this again, 24, 25, I forgot there was very many, 26, and 26.
26, I thought we might take a look at the doctor's e-bike parking meters.
That sounds excellent. So environment, this 27, 28, and 29. Okay, so pick one out that we want to have a bit of a further look at. Right, good. Are there any other urgent or written items for this committee to consider? Okay, thank you very much. Yes, I do apologise to everyone for the papers, but it was out of my control. It was due to some delays, but I do think the NHS paper, for example, was worth waiting for, and it was very helpful. So thank you very much, everybody, for being so sticking with it. Good night.
Thank you.
Thank you, Mary. Thank you.
No, no.